Question 1. To address the challenge of ensuring that learned behaviors are functionally useful and lead to improved quality of life for a client, which approach best integrates the importance of social skills in behavior development? Option A. Focus exclusively on teaching discrete, observable behaviors through repetitive drills, assuming social application will naturally follow. Option B. Prioritize the acquisition of academic or vocational skills that do not require significant social interaction, as these are often more easily measured. Option C. Implement strategies that minimize social exposure to prevent potential behavioral challenges, thereby creating a more controlled learning environment. Option D. Systematically embed opportunities to practice and generalize target behaviors within natural social interactions, while explicitly teaching social skills that facilitate these interactions. Correct answer is D. Systematically embed opportunities to practice and generalize target behaviors within natural social interactions, while explicitly teaching social skills that facilitate these interactions. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires balancing the immediate need for skill acquisition with the long-term developmental impact of social interaction. Behavioral technician must recognize that, while discrete skill teaching is important, the generalization and maintenance of those skills are heavily influenced by the individual's ability to engage socially. Over-reliance on isolated practice without social context can lead to skills that are not functional in real-world settings, potentially hindering the client's overall progress and quality of life. This requires careful judgment to ensure interventions are both effective in the short term and promote meaningful, sustainable development. Correct approach analysis. Prioritizing the integration of social skills into behavior development is best professional practice because it aligns with the core principles of applied behavior analysis, ABA, and ethical guidelines for behavioral technicians. The Behavior Analyst Certification Board, BAC, Professional and Ethical Compliance Code for Behavior Analysts, which guides the practice of registered behavior technicians, emphasizes the importance of promoting independence and improving the client's quality of life. Social skills are fundamental to achieving these goals, enabling individuals to form relationships, participate in community activities, and navigate daily life more effectively. By embedding social skill development within broader behavior plans, technicians ensure that learned behaviors are not only acquired, but also generalized and maintained across different environments and with various individuals, thereby maximizing the client's functional abilities and overall well-being. Incorrect approaches analysis. Focusing solely on discrete trial training for specific behaviors without incorporating social interaction components fails to address the functional application of those behaviors. This approach neglects the critical need for generalization and maintenance, which are often facilitated through social contexts. Ethically, this can lead to a client who can perform a skill in a controlled setting, but cannot use it effectively in their natural environment, thus not truly improving their quality of life as mandated by ethical codes. Implementing interventions that isolate the client from social opportunities to prevent challenging behaviors, while potentially reducing immediate incidents, is detrimental to long-term social development. This approach directly contradicts the ethical imperative to promote social integration and independence. It can inadvertently foster dependence and limit the client's exposure to natural learning opportunities, hindering their ability to develop crucial social competencies. Prioritizing the acquisition of academic or vocational skills over social skills, even if the client shows aptitude in those areas, overlooks the foundational role of social competence in overall functioning. While academic and vocational progress is important, the ability to interact socially underpins success in these domains and in life more broadly. An exclusive focus on non-social skills can lead to a client who is proficient in specific tasks but struggles with interpersonal relationships, impacting their overall life satisfaction and integration. Professional reasoning. Professionals should employ a decision-making process that begins with a thorough functional assessment of the client's needs, considering not only target behaviors, but also their social context and the client's overall quality of life. This involves identifying opportunities to teach and reinforce social skills alongside other behavioral goals. Professionals should consult relevant ethical codes and best practice guidelines, such as those provided by the BAC, to ensure interventions are client-centered, promote independence, and are delivered in a manner that maximizes generalization and maintenance. Continuous data collection and analysis are crucial to evaluate the effectiveness of social skill integration and to make necessary adjustments to the intervention plan. Question 2. Market research demonstrates that clients may exhibit heightened anxiety when directly observed during initial behavioral assessments. A behavioral technician is tasked with assessing the frequency of a specific challenging behavior in a new client. The technician has several potential assessment methods available. Which approach best balances the need for accurate data with the ethical imperative to minimize client distress? Option A. Rely exclusively on self-report measures from the client, assuming their introspection will provide accurate frequency data for the target behavior, and avoid any form of direct observation or caregiver interviews. Option B. Begin with indirect assessment methods, such as interviews with caregivers and a review of records, to gather initial information. If this proves insufficient, gradually introduce less intrusive direct observation techniques, carefully monitoring the client's response and adjusting as needed. Option C. Immediately commence direct, continuous observation of the client in their natural environment for an extended period to ensure the most comprehensive and objective data possible, regardless of the client's immediate comfort level. Option D. Utilize a single, highly structured direct observation protocol that involves the technician actively prompting the target behavior to ensure it occurs frequently enough to be measured accurately. The correct answer is B. Begin with indirect assessment methods, such as interviews with caregivers and a review of records, to gather initial information. If this proves insufficient, gradually introduce less intrusive direct observation techniques, carefully monitoring the client's response and adjusting as needed. Explanation. This scenario presents a common challenge for behavioral technicians, balancing the need for accurate data collection with the ethical imperative to avoid causing distress to the client. The professional challenge lies in recognizing that, while direct observation is the gold standard for behavior analysis, its application must be tempered by the client's well-being and the principles of least restrictive intervention. Careful judgment is required to select an assessment method that is both effective and ethically sound, aligning with the core tenets of behavior analysis and the specific ethical guidelines governing behavioral technicians. The correct approach represents best professional practice because it prioritizes the client's comfort and dignity while still gathering essential information. This aligns with the ethical principle of do no harm and the requirement to use the least intrusive assessment methods necessary to achieve the desired outcome. By employing a less intrusive method, initially and only escalating to more direct observation if needed, the technician demonstrates a commitment to client-centered care and adheres to the principle of proportionality in intervention. This approach is also consistent with the emphasis on functional assessment, which seeks to understand the antecedents and consequences of behavior in a naturalistic setting, but does so in a way that respects the individual. An incorrect approach that relies solely on direct, intrusive observation without considering the client's distress fails to uphold the ethical principle of beneficence, which mandates acting in the best interest of the client. It also risks violating the principle of respect for persons by disregarding the client's emotional state. Another incorrect approach that avoids any direct observation altogether, opting for purely indirect methods like interviews, may compromise the validity and reliability of the assessment. This could lead to an incomplete or inaccurate understanding of the target behavior, potentially resulting in ineffective or even harmful interventions. Such an approach fails to meet the professional standard of conducting thorough and objective assessments. Professionals should employ a decision-making framework that begins with a thorough understanding of the client's current state and the potential impact of different assessment methods. This involves considering the least restrictive alternative that can still yield sufficient data. If initial, less intrusive methods are insufficient, a gradual increase in intrusiveness, always monitoring the client's response, is warranted. This iterative process ensures that data collection is both effective and ethically responsible, prioritizing the client's well-being throughout the assessment and intervention process. Question 3. Market research demonstrates that clients often present with complex behavioral patterns that require careful interpretation of assessment data to develop effective intervention plans. A behavioral technician specialist has just completed a functional behavior assessment, FBA, for a client exhibiting disruptive behaviors in a classroom setting. The data collected includes direct observation notes, ABC antecedent behavior consequence, charts, and a behavior rating scale, which approach to analyzing and interpreting this assessment data is most aligned with professional best practices and regulatory guidelines for a behavioral technician specialist. Option A. Prioritize the behavior rating scale scores, using them as the sole basis for intervention, and disregard the ABC data and observation notes as they may be subjective or less quantifiable. Option B. Interpret the data based on personal experience with similar cases, assuming the underlying function of the behavior is likely the same as in previous clients, and proceed with a standard intervention protocol. Option C. Focus primarily on the direct observation notes, selecting anecdotal examples that seem most impactful or memorable to guide the intervention plan, as these often capture the essence of the client's challenges. Option D. Synthesize the ABC data to identify consistent antecedents and consequences that appear to trigger and maintain the disruptive behaviors, and then correlate these findings with the behavior rating scale to understand the intensity and frequency of the behaviors, ultimately informing the selection of intervention strategies that target these identified functional relationships. The correct answer is D. Synthesize the ABC data to identify consistent antecedents and consequences that appear to trigger and maintain the disruptive behaviors, and then correlate these findings with the behavior rating scale to understand the intensity and frequency of the behaviors, ultimately informing the selection of intervention strategies that target these identified functional relationships. Explanation. This scenario presents a professional challenge because a behavioral technician specialist, BTS, is tasked with interpreting assessment data to inform intervention planning. The challenge lies in ensuring the interpretation is accurate, objective, and directly linked to the client's needs and the assessment's purpose, while adhering strictly to the ethical and regulatory guidelines governing the profession. Misinterpreting data can lead to ineffective or even harmful interventions, directly impacting client progress and violating professional standards. Careful judgment is required to move beyond superficial observations to a nuanced understanding of the data's implications. The correct approach represents best professional practice because it involves a systematic and evidence-based analysis of the assessment data. This approach prioritizes identifying patterns, trends, and the functional relationships between behavior and environmental variables as indicated by the data. It aligns with the ethical obligation to provide services based on scientific principles and to ensure interventions are data-driven and client-centered. Specifically, it adheres to the principles of the Behavioral Technician Specialist Certification Framework, which emphasizes the importance of accurate data interpretation for effective service delivery and client well-being. This method ensures that intervention strategies are directly responsive to the assessed needs and are likely to yield positive outcomes. An incorrect approach that focuses solely on anecdotal observations without rigorous data analysis fails to meet professional standards. This is an ethical failure because it deviates from the requirement to base interventions on objective data, potentially leading to interventions that are not aligned with the client's actual needs or the underlying function of their behavior. Another incorrect approach that prioritizes the therapist's personal preferences or assumptions over the data is a significant ethical and regulatory violation. This demonstrates a lack of objectivity and can result in interventions that are not evidence-based, potentially harming the client and undermining the integrity of the profession. Furthermore, an approach that overgeneralizes findings from one assessment to unrelated behaviors without further data collection is also professionally unacceptable. This represents a failure to conduct a thorough and specific analysis, leading to potentially inaccurate conclusions and inappropriate intervention plans, which is a direct contravention of the principles of responsible data utilization. Professionals should employ a decision-making framework that begins with a clear understanding of the assessment's objectives and the specific questions it aims to answer. They should then systematically review all collected data, looking for patterns, correlations, and evidence of functional relationships. This analysis should be objective, avoiding personal biases or assumptions. The interpretation must then be directly translated into actionable intervention strategies that are evidence-based and tailored to the client's unique circumstances. Regular review and reanalysis of data are crucial to monitor progress and adjust interventions as needed, ensuring continuous adherence to ethical and regulatory requirements. Question 4. Compliance review shows that a behavioral technician is working with a client whose tantrums are believed to be maintained by social attention. The technician is considering how to address this behavior. Which of the following represents the most appropriate application of extinction procedures in this scenario? Option A. Withholding all social attention from the client when tantrums occur, while ensuring the client's safety and providing attention for appropriate behaviors. Option B. Ignoring the client completely when tantrums occur, regardless of safety concerns. Option C. Continuing to provide social attention to the client during tantrums to calm them down. Option D. Implementing a brief period of isolation for the client immediately following a tantrum. The correct answer is A. Withholding all social attention from the client when tantrums occur, while ensuring the client's safety and providing attention for appropriate behaviors. Explanation. Scenario analysis. This scenario presents a common challenge in behavioral technician practice, balancing the need to reduce problematic behavior with the ethical imperative to avoid reinforcing it. The technician must accurately identify the function of the behavior to select an appropriate intervention. Misinterpreting the function can lead to ineffective or even harmful interventions, potentially violating ethical codes and client rights. Correct approach analysis. The correct approach involves identifying the maintaining consequence of the problematic behavior and then withholding that consequence when the behavior occurs. This aligns with the core principles of extinction, which is a procedure designed to decrease behavior by removing reinforcement. For example, if a child's tantrums are maintained by parental attention, extinction would involve ignoring the tantrums. This approach is ethically sound and aligns with best practices in behavior analysis, emphasizing data-driven decision-making and client well-being. It directly addresses the function of the behavior, a cornerstone of effective intervention. Incorrect approaches analysis. One incorrect approach involves continuing to provide the attention that the child seeks when the tantrum occurs. This directly contradicts the principles of extinction and would likely reinforce the tantrum behavior, making it more frequent or intense. This is a failure to apply a scientifically validated procedure and could be considered a breach of professional competence. Another incorrect approach involves implementing a punishment procedure, such as timeout from positive reinforcement, without first confirming that the behavior is maintained by social reinforcement. Punishment procedures carry a higher risk of adverse effects and require careful consideration of ethical guidelines and client safety. Implementing such a procedure without a clear understanding of the behavior's function and without exhausting less intrusive options would be a significant ethical and professional failing. A third incorrect approach involves ignoring the behavior entirely without any plan to address its function or to ensure the safety of the client or others. While extinction involves withholding reinforcement, it is not synonymous with complete neglect. A well-designed extinction procedure includes a plan for managing the behavior when it occurs and ensuring safety, which this approach lacks. This could be seen as a failure to provide adequate supervision and intervention. Professional reasoning. Professionals should approach such situations by first conducting a thorough functional behavior assessment, FBA, to determine the maintaining consequence of the problematic behavior. Based on the FBA, they should select an intervention that aligns with the identified function and is the least intrusive effective option. This involves consulting relevant ethical codes and professional guidelines, such as those provided by the BACP, Behavior Analyst Certification Board, which emphasize client welfare, data-based decision-making, and the use of evidence-based practices. Continuous monitoring and data collection are crucial to evaluate the effectiveness of the intervention and make necessary adjustments. Question 5. Consider a scenario where a behavioral technician specialist, BTS, is working with a client and discovers a novel intervention described in a recent, non-peer-reviewed online forum. This intervention claims to produce rapid improvements in a target behavior that the client is struggling with. The BTS is eager to help the client achieve progress, but is aware that the intervention lacks empirical validation and has not been discussed with the Supervising Board's Certified Behavior Analyst, BCBA. What is the most appropriate course of action for the BTS? Option A. Discontinue using current interventions and wait for more information to become available on the novel technique, as it is important to stay current with new ideas. Option B. Research the intervention further, consult with the supervising BCBA, and discuss evidence-based alternatives before considering any new techniques. Option C. Inform the client's family about the intervention and ask for their permission to try it, as they are invested in the client's progress. Option D. Implement the novel intervention immediately to see if it works, as the potential for rapid progress is exciting and the client's current progress is slow. The correct answer is D. Implement the novel intervention immediately to see if it works, as the potential for rapid progress is exciting and the client's current progress is slow. Explanation. This scenario presents a professional challenge because it requires a behavioral technician specialist, BTS, to balance the immediate need for client progress with the ethical imperative of using evidence-based practices and ensuring client dignity. The BTS must make a judgment call on whether to proceed with a technique that, while potentially yielding rapid results, lacks robust empirical support and may not be the most appropriate or ethical intervention for the client's specific needs and context. Careful consideration of the principles of applied behavior analysis, ABA, is paramount. The correct approach represents best professional practice because it prioritizes the client's well-being and adherence to established ethical guidelines. By seeking consultation and considering alternative, evidence-based interventions, the BTS demonstrates a commitment to the principles of ABA, including the importance of data-driven decision-making, the least restrictive effective treatment, and the ongoing evaluation of interventions. This aligns with the ethical standards that mandate practitioners to use scientifically validated procedures and to act in the best interest of the client. An incorrect approach that involves implementing the unproven technique without further investigation or consultation would be a significant ethical failure. This could lead to ineffective treatment, potential harm to the client, and a violation of the principle of beneficence, acting in the client's best interest. It also disregards the ethical obligation to use scientifically validated interventions. Another incorrect approach, such as abandoning the client or the intervention without proper transition or consultation, would also be ethically problematic, potentially leading to a disruption in services and a failure to meet the client's ongoing needs. This demonstrates a lack of professional responsibility and commitment to continuity of care. The professional decision-making process for similar situations should involve a systematic approach. First, identify the core ethical and professional dilemma. Second, consult relevant ethical codes and best practice guidelines. Third, seek supervision or consultation from a qualified BCBA or supervisor. Fourth, evaluate the evidence base for proposed interventions. Fifth, consider the client's individual needs, preferences, and the least restrictive effective treatment options. Finally, document all decisions and rationale thoroughly. Question 6. The investigation demonstrates that a behavioral technician is reviewing the foundational principles of behavior analysis to prepare for their certification exam. They are specifically trying to identify the psychologist most credited with coining the term operant conditioning and developing the experimental analysis of behavior. Option A, Ivan Pavlov. Option B, Albert Bandura. Option C, B. F. Skinner. Option D, Sigmund Freud. The correct answer is C. B. F. Skinner. Explanation. The investigation demonstrates a scenario where a behavioral technician is tasked with implementing a behavior intervention plan, BIP, for a client. The challenge lies in accurately attributing the foundational principles of behavior analysis to their originators, which is crucial for understanding the theoretical underpinnings of the BIP and for ethical practice. Misattributing contributions can lead to a misunderstanding of the field's development and potentially impact the technician's ability to critically evaluate and adapt interventions. The correct approach involves accurately identifying B. F. Skinner as the key figure who coined the term operant conditioning, and extensively developed the principles of behavior analysis, including concepts like reinforcement, punishment, extinction, and schedules of reinforcement. This accurate attribution is essential for demonstrating a foundational understanding of the science, as required by the Behavioral Technician Specialist Certification Exam. It reflects a commitment to the scientific integrity of the field and ensures that the technician is building their practice on a solid theoretical base, aligning with the ethical standards of the Behavior Analyst Certification Board, BAC, which emphasizes the importance of understanding the foundational principles of behavior analysis. An incorrect approach would be to attribute the primary development of operant conditioning and behavior analysis to Ivan Pavlov. While Pavlov's work on classical conditioning is foundational to understanding learning, it is distinct from Skinner's operant conditioning. This misattribution demonstrates a lack of understanding of the core concepts tested in behavior analysis and could lead to the application of inappropriate intervention strategies. It represents a failure to adhere to the scientific accuracy expected of a certified professional. Another incorrect approach would be to credit Albert Bandura with the primary development of operant conditioning. Bandura is renowned for his work on social learning theory and observational learning, which are important concepts, but are not synonymous with Skinner's operant conditioning. This error indicates a confusion between different theoretical frameworks within psychology and behaviorism, failing to grasp the specific contributions of Skinner to behavior analysis. Finally, attributing the core principles of operant conditioning to Sigmund Freud would be a significant error. Freud's work is central to psychodynamic theory and psychoanalysis, focusing on unconscious drives and early childhood experiences, which are fundamentally different from the principles of behavior analysis that focus on observable behavior and its environmental contingencies. This misattribution highlights a profound misunderstanding of the field of behavior analysis and its scientific origins. Professionals should approach such questions by recalling the seminal figures and their specific contributions to behavior analysis. When in doubt, it is advisable to review foundational texts and resources that clearly delineate the work of key figures like Skinner, Pavlov, Bandura, and Freud. This ensures that practice is grounded in accurate scientific understanding and ethical adherence to the principles of behavior analysis. Question 7. Upon reviewing a client's progress notes, a behavioral technician observes that a punishment procedure was implemented yesterday to address a target behavior. The technician recalls that the supervising behavior analyst had mentioned the possibility of using this procedure, but the technician did not obtain explicit, documented, informed consent from the client's legal guardian prior to its implementation, nor was the procedure detailed in the current treatment plan. What is the most ethically and regulatorily sound course of action for the behavioral technician? Option A. Immediately cease the use of the punishment procedure and report the situation to the supervising behavior analyst, requesting a review of the procedure and the process for obtaining informed consent. Option B. Document the implementation of the punishment procedure in the client's notes and proceed with obtaining consent from the guardian retrospectively. Option C. Implement an alternative, less restrictive intervention without consulting the supervisor or guardian, as the punishment procedure was not formally documented. Option D. Continue using the punishment procedure as directed by the supervisor, assuming their approval supersedes the need for explicit guardian consent for this specific instance. The correct answer is A. Immediately cease the use of the punishment procedure and report the situation to the supervising behavior analyst, requesting a review of the procedure and the process for obtaining informed consent. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves the application of a punishment procedure, which carries significant ethical and regulatory weight. The core difficulty lies in balancing the potential effectiveness of the procedure with the paramount importance of client welfare, dignity, and adherence to established ethical guidelines and regulations governing behavioral services. The technician must navigate the complexities of informed consent, the least restrictive alternative principle, and the potential for unintended negative consequences. Correct approach analysis. The correct approach prioritizes obtaining explicit, informed consent from the client or their legal guardian before implementing any punishment procedure. This aligns directly with ethical principles of autonomy and beneficence, as well as regulatory requirements that mandate client assent and guardian consent for interventions. The process must involve a thorough discussion of the procedure's rationale, potential risks and benefits, alternative interventions, and the client's right to withdraw consent. This ensures the client's rights are protected and that the intervention is applied ethically and legally. Incorrect approaches analysis. Implementing a punishment procedure without documented, informed consent from the client or their legal guardian is a direct violation of ethical codes and regulatory frameworks. This failure undermines client autonomy and can lead to accusations of abuse or neglect. Proceeding with a punishment procedure based solely on the recommendation of a supervisor, without independent verification of informed consent or a review of the client's rights, represents a failure in professional responsibility and oversight. It shifts accountability away from the direct service provider and can mask ethical breaches. Using a punishment procedure that has not been explicitly outlined in the client's treatment plan, even if verbally approved by a supervisor, is problematic. Treatment plans are typically formal documents requiring specific approvals and detailing interventions. Deviating from this without proper amendment and consent bypasses established protocols and can lead to inconsistent or inappropriate application of interventions. Professional reasoning. Professionals should approach decisions regarding punishment procedures with extreme caution. The decision-making process should begin with a thorough review of the client's current treatment plan and the ethical and regulatory guidelines applicable to the jurisdiction. If a punishment procedure is being considered, the professional must ensure that it is the least restrictive effective intervention available, that it has been thoroughly discussed with the client and/or their guardian, and that explicit, documented informed consent has been obtained. A clear, step-by-step process involving assessment, ethical review, client/guardian consultation, and documented consent is crucial before any such intervention is implemented. Question 8. Benchmark analysis indicates that a behavioral technician specialist, BTS, is tasked with understanding the antecedents and consequences of a client's challenging behavior. The client is unable to provide detailed self-reports due to their developmental level. The BTS has access to the client's parents and teachers who have agreed to participate in the assessment process. Which of the following strategies best aligns with the principles of indirect assessment for this scenario? Option A. Conduct structured interviews with the parents and teachers, asking specific, open-ended questions about the target behavior, its triggers, and what happens immediately before and after. Option B. Ask the parents and teachers to complete a generic checklist of common behaviors without focusing on the specific target behavior. Option C. Rely solely on the initial anecdotal descriptions provided by the parents without further inquiry. Option D. Develop and administer a complex, multi-page questionnaire to the parents and teachers that includes jargon and technical terms related to behavior analysis. The correct answer is A. Conduct structured interviews with the parents and teachers, asking specific, open-ended questions about the target behavior, its triggers, and what happens immediately before and after. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a behavioral technician specialist, BTS, to gather information about a client's behavior without direct observation. This reliance on indirect methods, such as interviews and questionnaires, introduces potential biases and inaccuracies. The BTS must navigate the subjective nature of self-reports and informant reports while ensuring the information gathered is relevant, reliable, and ethically obtained, adhering strictly to the Behavioral Technician Specialist Certification Framework. Correct approach analysis. The correct approach involves systematically gathering information through interviews and questionnaires, ensuring that the questions are clear, unbiased, and directly relevant to the target behaviors. This method aligns with best professional practice by acknowledging the importance of understanding the client's environment and perspectives as reported by themselves or their caregivers. It is ethically sound as it respects client autonomy and privacy while seeking to understand behavior within its context, as mandated by the ethical guidelines for BTS, which emphasize data-driven decision-making and client-centered care. Incorrect approaches analysis. One incorrect approach would be to solely rely on the first piece of information provided by a caregiver without seeking further clarification or corroboration. This fails to address potential biases inherent in informant reports and could lead to an incomplete or inaccurate understanding of the behavior, violating the principle of thorough assessment. Another incorrect approach would be to use leading questions during an interview that subtly steer the respondent towards a particular answer. This compromises the objectivity of the data collected and can lead to biased interpretations, which is ethically problematic as it does not represent the client's behavior accurately. A third incorrect approach would be to administer a questionnaire that is not validated or appropriate for the client's age, cognitive abilities, or cultural background. This can result in meaningless or misleading data, hindering effective intervention planning and potentially causing harm by leading to inappropriate treatment strategies, which is a failure to adhere to professional standards of practice. Professional reasoning. Professionals should approach indirect assessment by first identifying the specific behaviors of concern and the context in which they occur. They should then select appropriate indirect assessment methods, such as structured interviews or validated questionnaires, that are tailored to the client and the target behaviors. It is crucial to triangulate information by gathering data from multiple sources, e.g., client, caregivers, teachers, and using multiple methods where possible. All data collection must be conducted ethically, ensuring informed consent, confidentiality, and the avoidance of bias. The information gathered should then be analyzed to form hypotheses about the function of the behavior, guiding the development of effective interventions. Question 9. Examination of the data shows that a client has mastered a specific social skill in a controlled setting. The technician is considering implementing natural environment training, NET, during a community outing. What is the most appropriate approach to ensure ethical and effective implementation of NET? Option A. Implement NET in a contrived area of the community that mimics a natural setting, but minimizes potential social interactions and distractions. Option B. Obtain informed consent from the client for the NET session, assess the community environment for appropriateness and potential distractions, and ensure the training is delivered in a manner that respects the client's comfort and social interactions. Option C. Proceed with NET during the community outing without explicit prior consent, assuming the client will benefit from the generalization of the skill. Option D. Focus solely on the technician's ability to prompt and reinforce the skill in the community setting, regardless of the client's engagement or comfort. The correct answer is B. Obtain informed consent from the client for the NET session, assess the community environment for appropriateness and potential distractions, and ensure the training is delivered in a manner that respects the client's comfort and social interactions. Explanation. This scenario presents a professional challenge because it requires a behavioral technician specialist, BTS, to balance the effectiveness of natural environment training, NET, with the ethical imperative of client dignity and autonomy. NET aims to generalize learned skills to real-world settings, which is a core principle of applied behavior analysis. However, implementing NET without careful consideration of the client's comfort, the natural social context, and the potential for unintended consequences can lead to a breakdown in trust and a violation of ethical standards. The BTS must exercise judgment to ensure that training is not only effective, but also respectful and client-centered. The correct approach represents best professional practice because it prioritizes the client's well-being and autonomy while still leveraging the benefits of NET. By obtaining informed consent, assessing the environment for appropriateness, and ensuring the training is delivered in a way that respects the client's social interactions and comfort level, the BTS upholds the ethical guidelines of the Behavior Analyst Certification Board, BAC, which are paramount for BTSs operating under U.S. regulatory frameworks. This approach ensures that training is functional, ethical, and respects the client's right to self-determination and privacy. An incorrect approach that involves implementing NET without explicit consent or by forcing the client into situations they are uncomfortable with represents a significant ethical failure. This violates the BAC ethical code, specifically regarding informed consent and avoiding harm. It disregards the client's right to refuse participation or to have their dignity respected. Another incorrect approach, such as solely relying on contrived settings that do not generalize well, fails to meet the objective of NET and may not be the most effective use of client and technician time, potentially leading to a lack of progress and a failure to meet treatment goals, which indirectly impacts the client's right to effective services. A third incorrect approach, focusing only on the technician's convenience rather than the client's learning environment, disregards the core principles of NET and client-centered care, potentially leading to ineffective training and a breach of professional responsibility. Professionals should use a decision-making process that begins with a thorough understanding of the client's goals and preferences. This is followed by an assessment of the natural environment's suitability for training, considering potential distractions, social dynamics, and safety. Crucially, obtaining informed consent from the client or their guardian for any NET activities is non-negotiable. The plan should then be implemented with ongoing observation and data collection, allowing for adjustments based on the client's response and progress, always prioritizing their dignity and autonomy. Question 10. Performance analysis shows a client consistently engages in disruptive vocalizations during group therapy sessions, despite reporting feeling calm and engaged in their session notes. The behavioral technician is tasked with implementing a plan to reduce the disruptive vocalizations. Option A. Encourage the client to explore the underlying reasons for their vocalizations by asking probing questions about their thoughts and feelings during the session. Option B. Advise the client that their reported feelings are inconsistent with their behavior and instruct them to stop vocalizing immediately. Option C. Focus on teaching the client relaxation techniques to manage their internal emotional state, assuming the vocalizations are a direct result of anxiety. Option D. Implement strategies to reinforce quiet behavior and provide differential reinforcement for periods of silence, while tracking the frequency and duration of vocalizations. The correct answer is D. Implement strategies to reinforce quiet behavior and provide differential reinforcement for periods of silence, while tracking the frequency and duration of vocalizations. Explanation. Scenario analysis. This scenario presents a common challenge in behavioral intervention, where a client's observable behaviors are not aligning with their reported internal states or motivations. The professional must discern whether to focus solely on the observable, measurable actions, behaviorism, or to consider the underlying thoughts, feelings, and beliefs that may be influencing those actions, cognitive psychology. This requires careful judgment to ensure the intervention is effective, ethical, and respects the client's subjective experience, all within the ethical guidelines of the Behavioral Technician Specialist certification. Correct approach analysis. The correct approach emphasizes a behaviorist framework, which is the foundation of the Behavioral Technician Specialist certification. This approach is best professional practice because it aligns with the core principles of applied behavior analysis, ABA, focusing on observable and measurable behaviors and their environmental antecedents and consequences. This allows for objective data collection, reliable assessment of intervention effectiveness, and adherence to the ethical standards that mandate evidence-based practices and client progress monitoring. The focus on behavior directly addresses the technician's scope of practice, which is to implement behavior change strategies based on established principles. Incorrect approach is analysis. An approach that solely focuses on the client's self-reported feelings without linking them to observable behaviors or environmental factors fails to adhere to the behaviorist principles central to the certification. This can lead to interventions that are not empirically supported or measurable, potentially violating ethical guidelines regarding client progress and effective service delivery. An approach that attempts to directly interpret or change the client's internal thoughts without a clear behavioral link, or without being within the scope of practice for a behavioral technician, is problematic. Cognitive factors can influence behavior. A technician's role is typically to implement interventions based on behavioral principles, not to conduct cognitive therapy. This could lead to practicing outside one's competency and ethical boundaries. An approach that dismisses the client's reported feelings entirely and rigidly focuses only on behavior without any consideration for how internal states might be communicated or indirectly influence behavior, even if not directly addressed, might miss opportunities for rapport building and a more holistic understanding of the client's presentation, though the primary intervention must remain behaviorally focused. Professional reasoning. Professionals should approach such situations by first identifying the core principles of their certification and scope of practice. In this case, the Behavioral Technician Specialist certification is rooted in behaviorism. The professional decision-making process involves 1. Identifying the observable behaviors of concern. 2. Collecting data on these behaviors, including antecedents and consequences. 3. Developing and implementing interventions based on established behaviorist principles. 4. Continuously monitoring the effectiveness of interventions through data. 5. Consulting with supervisors or BCBA when client presentation or intervention effectiveness is unclear, especially when considering factors that may extend beyond direct behavioral observation. The focus remains on what can be objectively measured and modified through behavioral strategies. Question 11. The risk matrix shows a high probability of noncompliance with the client's stated preferences during a new skill acquisition program for a client with limited verbal communication. The Behavioral Technician Specialist, BTS, is tasked with implementing a new daily living skill. What is the most appropriate course of action to ensure ethical and effective skill acquisition? Option A. Utilize a procedure that incorporates mild punishment to discourage incorrect responses, thereby accelerating the learning process and ensuring adherence to the target skill. Option B. Proceed with the most efficient teaching procedure based on the skill's complexity, assuming the client will benefit from rapid acquisition regardless of their immediate expressed preferences. Option C. Focus exclusively on the technical steps of the skill, providing reinforcement only upon successful completion of the entire task, without actively seeking client input on the process. Option D. Implement a systematic reinforcement procedure using highly preferred items identified through direct observation and preference assessments, while also attempting to elicit verbal or nonverbal assent from the client regarding the steps of the skill. Correct answer is D. Implement a systematic reinforcement procedure using highly preferred items identified through direct observation and preference assessments, while also attempting to elicit verbal or nonverbal assent from the client regarding the steps of the skill. Explanation. This scenario presents a professional challenge because it requires a behavioral technician specialist, BTS, to balance the immediate need for skill acquisition with the ethical imperative to ensure client dignity and autonomy, all within the specific regulatory framework of the Behavioral Technician Specialist certification. The core tension lies in selecting an intervention that is both effective for skill development and respects the client's right to participate in their own learning process. The correct approach represents best professional practice because it prioritizes a collaborative and client-centered method for skill acquisition. This aligns with ethical guidelines that emphasize client assent and the least restrictive intervention necessary. By involving the client in identifying preferred reinforcers and discussing the rationale behind the skill, the BTS fosters a sense of agency and increases the likelihood of sustained skill use. This approach is directly supported by the principles of applied behavior analysis, ABA, and the ethical codes governing behavior technicians, which mandate respect for client rights and preferences. An incorrect approach that focuses solely on rapid acquisition without client input fails to uphold the ethical principle of client autonomy. It risks creating a situation where the client learns a skill under duress or without understanding its purpose, potentially leading to resistance, decreased motivation, and a superficial understanding of the skill. This approach could be seen as a violation of the client's right to assent to interventions and could be interpreted as a failure to provide services in a manner that respects the client's dignity. Another incorrect approach that relies on aversive consequences to drive skill acquisition is ethically unacceptable and likely violates regulatory guidelines. Such methods can cause distress, damage the therapeutic relationship, and are generally considered to be outside the scope of ethical practice for behavior technicians. The focus must always be on positive reinforcement and building skills in a supportive environment. The professional reasoning process for similar situations should involve a thorough assessment of the client's current skill level, preferences, and any potential barriers to learning. The BTS must then consult relevant ethical codes and best practice guidelines to select interventions that are evidence-based, client-centered, and least restrictive. Open communication with the client and their support network is crucial to ensure understanding, buy-in, and to adapt the intervention as needed. The goal is always to promote meaningful skill acquisition that enhances the client's quality of life. Question 12. Analysis of a behavioral technician's responsibility after a client has successfully acquired a target behavior, considering the need for the behavior to persist in the absence of constant direct intervention. Which strategy best supports the long-term maintenance of this learned behavior? Option A. Continue providing the same level of direct prompting and artificial reinforcement as during the acquisition phase. Option B. Gradually fade prompts and shift reinforcement to naturally occurring consequences within the client's environment. Option C. Immediately withdraw all prompts and reinforcement once the target behavior is demonstrated consistently. Option D. Focus exclusively on teaching new skills without a specific plan for maintaining the recently acquired behavior. Correct answer is B. Gradually fade prompts and shift reinforcement to naturally occurring consequences within the client's environment. Explanation. Scenario analysis. This scenario presents a common challenge in behavioral technician practice, ensuring the long-term effectiveness of interventions. The client has achieved a target behavior, but the technician must now focus on its maintenance without continuous direct intervention. This requires a shift from acquisition to generalization and maintenance, demanding foresight and strategic planning to prevent skill regression. The professional challenge lies in balancing the need for continued support with fostering client independence and ensuring the behavior is robust enough to persist in natural environments. Correct approach analysis. The correct approach involves systematically fading prompts and increasing the reliance on naturally occurring reinforcers within the client's environment. This aligns with best professional practice by promoting generalization and maintenance, as outlined in ethical guidelines that emphasize client progress towards independence and the use of effective, evidence-based strategies. Specifically, this approach adheres to principles of applied behavior analysis, ABA, that prioritize functional reinforcers and environmental support over artificial or continuous prompting, thereby increasing the likelihood of sustained behavior change. This strategy is crucial for ensuring the client can perform the behavior without constant technician support, a core objective of behavioral services. Incorrect approaches analysis. One incorrect approach involves continuing to provide the same level of direct prompting and reinforcement as during the acquisition phase. This fails to address the maintenance phase and can lead to prompt dependency, hindering the client's generalization of the skill to natural environments. Ethically, this represents a failure to progress the client towards independence and may constitute an inefficient use of resources, potentially violating principles of providing effective and appropriate services. It also fails to adhere to the principle of fading supports as skills are acquired. Another incorrect approach is to completely withdraw all support and reinforcement immediately after the target behavior is met. This abrupt cessation can lead to rapid behavior regression, as the client may not have yet fully generalized the behavior or learned to access naturally occurring reinforcers. This approach is ethically problematic, as it abandons the client before the behavior is truly maintained and may violate the duty to ensure the long-term success of interventions. It neglects the crucial step of ensuring the behavior is robust and self-sustaining. A third incorrect approach is to focus solely on introducing new, unrelated skills without a plan for maintaining the recently acquired behavior. While expanding the client's repertoire is important, neglecting the maintenance of existing skills can lead to a loss of progress and a fragmented skill set. This is ethically questionable, as it suggests a lack of comprehensive planning and a failure to ensure the durability of learned behaviors, which is a fundamental aspect of effective behavioral intervention. Professional reasoning. Professionals should employ a decision-making framework that prioritizes a phased approach to intervention. This involves 1. Assessing the client's current skill level and environmental context. 2. Developing a plan for skill acquisition, generalization, and maintenance. 3. Systematically implementing interventions, including prompt fading and reinforcement schedule adjustments. 4. Continuously monitoring the behavior's performance in various settings and with different reinforcers. And 5. Adapting the plan as needed to ensure sustained progress and independence. This framework ensures that interventions are not only effective in teaching new behaviors, but also in ensuring those behaviors persist over time and across different situations, aligning with ethical obligations to provide high-quality, client-centered services. Question 13. Operational review demonstrates that a behavioral technician specialist, BTS, is tasked with graphing data collected on a client's target behavior, which is a frequency measure. The BTS has several graphing options available, each with different visual characteristics. The goal is to select the graph that best facilitates the visual analysis of the client's progress and informs treatment decisions. Which graphing approach best aligns with ethical and professional standards for data representation in applied behavior analysis? Option A. A line graph that clearly plots the frequency of the target behavior across sessions, with clear axis labels and a title indicating the behavior and client. Option B. A pie chart that shows the proportion of sessions in which the behavior occurred, without indicating the frequency or trend over time. Option C. A scatter plot that displays the occurrence of the behavior in relation to specific times of day or activities, but does not clearly show the overall frequency trend. Option D. A bar graph that aggregates all data points into a single average frequency for the entire intervention period, obscuring session-to-session variability. The correct answer is A. A line graph that clearly plots the frequency of the target behavior across sessions, with clear axis labels and a title indicating the behavior and client. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a behavioral technician specialist, BTS, to interpret and act upon visual data representations of client progress. The challenge lies in ensuring that the graphing of data is not only technically accurate, but also ethically sound and aligned with the client's best interests and the principles of applied behavior analysis, ABA. Misinterpreting or misrepresenting data can lead to ineffective interventions, wasted resources, and potential harm to the client. The BTS must exercise professional judgment to select the most appropriate graphing method that clearly communicates the client's performance and facilitates informed decision-making by the supervising BCBA and other stakeholders. Correct approach analysis. The correct approach involves selecting a graph that accurately and clearly depicts the client's response rate or frequency over time, allowing for easy visual analysis of trends, variability, and level. This aligns with the ethical obligation to maintain accurate and objective records and to use data to guide intervention decisions. The Behavior Analyst Certification Board, BAC, Professional and Ethical Compliance Code for Behavior Analysts, PEC, emphasizes the importance of data-based decision-making and accurate record-keeping. A graph that clearly shows the relationship between intervention and behavior change is crucial for demonstrating efficacy and making necessary adjustments, thereby upholding the client's right to effective treatment. Incorrect approaches analysis. One incorrect approach would be to choose a graph that obscures or misrepresents the data, such as a graph with an inappropriate scale or one that combines disparate behaviors without clear justification. This violates the PEC mandate for accurate data collection and reporting. Another incorrect approach is to prioritize a visually appealing graph over one that is functionally informative for analysis, potentially leading to misinterpretations by the supervising BCBA or stakeholders. This could be seen as a failure to uphold the principle of providing effective services. Furthermore, selecting a graph that is overly complex or difficult to interpret for the intended audience without providing clear explanations could also be considered an ethical lapse, as it hinders transparent communication and collaborative decision-making. Professional reasoning. Professionals should approach data graphing by first considering the purpose of the graph, to visually represent behavior change and inform intervention decisions. They should then consider the type of behavior being measured and the most appropriate graphical representation for that data, e.g., line graphs for continuous data, bar graphs for discrete comparisons. The chosen graph must be clear, accurate, and easy to interpret by the supervising BCBA and other relevant parties. Professionals should consult relevant BAC ethical guidelines and best practice standards for ABA to ensure their graphing practices are both technically sound and ethically compliant. When in doubt, seeking supervision and clarification from the BCBA is paramount. Question 14. The assessment process reveals that a client's acquisition of a target skill has significantly slowed, and data collected over the past 2 weeks shows no measurable improvement. What is the most appropriate next step for the behavioral technician to take? Option A. Systematically review the collected data to identify trends, analyze potential reasons for the plateau, and consult with the supervising BCBA to discuss findings and potential adjustments to the intervention plan. Option B. Immediately implement a completely new intervention strategy that has been successful with other clients, without further data analysis or consultation. Option C. Continue implementing the current intervention as planned, assuming the plateau is a temporary phase in the learning process. Option D. Conclude that the client is not capable of acquiring the skill and recommend discontinuing services for that target behavior. The correct answer is A. Systematically review the collected data to identify trends, analyze potential reasons for the plateau, and consult with the supervising BCBA to discuss findings and potential adjustments to the intervention plan. Explanation. The assessment process reveals a client's progress on a target behavior has plateaued, despite consistent implementation of the planned intervention. This scenario is professionally challenging because it requires the behavioral technician to move beyond simply executing a plan to actively analyzing its effectiveness and making informed adjustments. The technician must exercise careful judgment to determine the root cause of the plateau and select the most appropriate course of action, ensuring client well-being and adherence to ethical and regulatory standards. The correct approach represents best professional practice because it directly addresses the core principle of data-driven decision-making, which is fundamental to ethical and effective behavioral intervention. By reviewing the collected data, identifying trends, and considering potential confounding variables, the technician is engaging in a systematic and evidence-based process. This aligns with the ethical obligation to provide competent services and to ensure interventions are effective and responsive to the client's needs. Regulatory frameworks for behavioral technicians emphasize the importance of ongoing assessment and data utilization to guide practice, ensuring that interventions are not static but dynamic and responsive to individual client progress. This approach prioritizes the client's best interests by seeking to optimize their learning and progress. An incorrect approach that involves continuing the current intervention without modification, despite the plateau, represents a failure to adhere to the principle of ongoing assessment and data utilization. This can lead to wasted time and resources, and more importantly, can hinder the client's progress, potentially violating ethical obligations to provide effective services. It also fails to meet the regulatory expectation of adapting interventions based on performance data. Another incorrect approach, such as unilaterally changing the intervention without consulting the supervising BCBA or reviewing the data, is a significant ethical and regulatory failure. This bypasses the established hierarchy of supervision and the requirement for evidence-based practice. It undermines the collaborative nature of intervention planning and can lead to the implementation of ineffective or even detrimental strategies. The technician is not authorized to make such significant clinical decisions independently. A further incorrect approach, such as attributing the plateau solely to external factors without a thorough data review or consideration of intervention fidelity, is also professionally unacceptable. While external factors can influence behavior, a responsible technician must first exhaust all possibilities related to the intervention itself and the data collected. This approach demonstrates a lack of critical analysis and a potential bias that could prevent the identification of necessary intervention adjustments. Professionals should employ a decision-making framework that begins with a thorough review of all collected data. This includes examining trends, identifying any potential outliers or inconsistencies, and assessing intervention fidelity. Following this data review, the technician should consult with their supervising BCBA to discuss the findings and collaboratively develop a plan for intervention modification or further assessment. This ensures that decisions are evidence-based, ethically sound, and aligned with regulatory requirements for competent practice. Question 15. Research into effective methods for teaching a new functional communication skill, such as requesting a preferred item, to a young child with autism spectrum disorder has identified several potential strategies. The behavioral technician is tasked with implementing a plan to teach the child to request a specific toy. The child is easily distracted and has a limited attention span. Which of the following approaches best aligns with ABA principles for teaching new skills in this context? Option A. Implement a discrete trial training (DTT) protocol, breaking down the request into small steps, using immediate reinforcement for correct responses, and systematically collecting data on the child's attempts and successes to guide further instruction and prompt fading. Option B. Introduce the toy along with several other distracting items and verbally prompt the child to ask for the toy while simultaneously modeling the full request. Option C. Present the target toy and wait for the child to spontaneously vocalize or gesture towards it, reinforcing any approximation of a request with a highly preferred item. Option D. Rely on the child's existing imitative behaviors to learn the request by modeling the full phrase repeatedly when the toy is present. The correct answer is A. Implement a discrete trial training (DTT) protocol, breaking down the request into small steps, using immediate reinforcement for correct responses, and systematically collecting data on the child's attempts and successes to guide further instruction and prompt fading. Explanation. This scenario presents a common challenge in behavioral technician practice, adapting evidence-based ABA principles to a client's unique learning style and environmental factors. The professional must balance the need for structured skill acquisition with the client's engagement and generalization of learned behaviors. Careful judgment is required to select the most effective and ethical teaching strategy. The correct approach represents best professional practice because it prioritizes a systematic, data-driven method for skill acquisition that is also client-centered. This involves breaking down the target skill into manageable steps, task analysis, using reinforcement to motivate the client, and collecting data to monitor progress and inform instructional decisions. This aligns with the core tenets of ABA and the ethical guidelines for behavioral technicians, which emphasize client dignity, effective treatment, and continuous evaluation. The focus on generalization ensures the skill is functional and can be used in various settings, a key outcome of effective ABA intervention. An incorrect approach that relies solely on rote repetition, without considering the client's engagement or understanding, fails to adhere to the principle of effective treatment. It may lead to frustration for the client and a lack of true skill acquisition. Ethically, this could be seen as a failure to provide the most beneficial intervention. Another incorrect approach that introduces multiple new stimuli simultaneously without a clear plan for stimulus control can overwhelm the client and hinder learning. This violates the principle of providing a structured and supportive learning environment. Finally, an approach that neglects data collection and relies on subjective observation is not scientifically sound and prevents objective evaluation of treatment efficacy, which is a cornerstone of ethical and effective ABA practice. Professionals should use a decision-making framework that begins with a thorough assessment of the client's current skill level and learning preferences. This is followed by developing a clear, measurable objective and a detailed intervention plan that includes a task analysis, reinforcement strategy, and data collection procedures. Regular review of data is crucial for making informed decisions about fading prompts, increasing the complexity of the skill, and planning for generalization. Collaboration with supervisors and other professionals is also vital to ensure the highest quality of care. Question 16. The monitoring system demonstrates that a behavior intervention plan BIP was developed for a client, but the documentation indicates that the client was not actively involved in the discussion or provided an opportunity to assent to the proposed strategies, despite having the capacity to understand basic explanations. Which of the following actions best reflects adherence to professional and regulatory standards for BIP development? Option A. Immediately revise the BIP to include a clear, client-centered explanation of the interventions and actively seek the client's assent, documenting this collaborative process. Option B. Proceed with implementing the BIP as written, assuming that the professional's expertise supersedes the need for client assent in this instance. Option C. Implement the BIP and schedule a follow-up session to explain the interventions to the client after they have begun. Option D. Inform the client's guardian that the BIP has been finalized and will be implemented, without further discussion with the client. The correct answer is A. Immediately revise the BIP to include a clear, client-centered explanation of the interventions and actively seek the client's assent, documenting this collaborative process. Explanation. The scenario presents a common challenge in behavioral intervention plan, BIP, development. Balancing the need for effective interventions with the ethical imperative of client assent and the practicalities of implementation. A professionally challenging aspect is ensuring that the BIP is not only evidence-based and aligned with the client's needs, but also respects the client's autonomy and capacity to understand and agree to the proposed strategies. This requires careful consideration of the client's developmental level, communication abilities, and the potential impact of interventions on their daily life. The correct approach represents best professional practice because it prioritizes a collaborative and informed process. By involving the client, or their guardian, if applicable, in the discussion of the BIP, explaining the rationale behind interventions in an understandable manner, and seeking their assent, professionals uphold ethical standards of respect for autonomy and informed consent. This aligns with the core principles of behavioral services, which emphasize client-centered care and the empowerment of individuals receiving services. Regulatory frameworks for behavioral technicians often mandate such collaborative practices to ensure that interventions are not imposed, but are mutually agreed upon, fostering greater adherence and positive outcomes. Incorrect approaches fail to meet these professional and regulatory expectations. One incorrect approach might involve developing and implementing a BIP without any discussion or attempt to gain assent from the client. This constitutes a significant ethical failure, potentially violating principles of autonomy and dignity. It also risks creating a plan that is not practical or acceptable to the client, leading to resistance and reduced effectiveness, which could be seen as a failure to provide competent and ethical services as outlined in professional guidelines. Another incorrect approach could be to present a highly technical BIP to a client who lacks the cognitive or communication capacity to understand it, without adapting the explanation. This, while perhaps well-intentioned, still fails to ensure genuine informed assent and can be seen as a failure to adequately communicate and educate the client about their own treatment, thereby undermining the collaborative spirit and potentially leading to non-compliance or distress. Professional decision-making process for similar situations should involve a tiered approach. First, thoroughly assessing the client's needs and identifying evidence-based interventions. Second, considering the client's developmental, cognitive, and communication abilities to determine the most appropriate way to present the BIP. Third, engaging in a clear, age-appropriate, and understandable explanation of the BIP's goals, procedures, and expected outcomes. Fourth, actively seeking the client's assent, respecting their right to refuse or question aspects of the plan. Finally, documenting the entire process, including the client's participation and assent, to ensure accountability and adherence to ethical and regulatory standards. Question 17. The monitoring system demonstrates that client has mastered a target skill during structured training sessions, but there is no data indicating whether this skill is performed consistently in different environments or with various individuals. Which of the following approaches best reflects best professional practice in evaluating the effectiveness of the intervention regarding generalization and maintenance? Option A. Conclude that the intervention has been successful because the skill was mastered in the training environment, and no further data collection is immediately necessary. Option B. Systematically collect data on the target skill's performance across various settings and with different individuals, and continue to monitor its use over time to assess generalization and maintenance. Option C. Assume that generalization and maintenance will naturally occur as the client becomes more familiar with the skill, and therefore no specific programming or data collection for these aspects is required. Option D. Rely solely on verbal reports from the client and their caregivers about whether they believe the skill is being used outside of sessions. The correct answer is B. Systematically collect data on the target skill's performance across various settings and with different individuals, and continue to monitor its use over time to assess generalization and maintenance. Explanation. The monitoring system demonstrates a common challenge in behavioral intervention, ensuring that learned skills are not confined to the specific training environment or conditions. Generalization, the ability to perform a skill in new settings, with different people, or under varied circumstances. And maintenance, the continued performance of a skill over time after intervention has ceased or been reduced, are critical indicators of treatment efficacy. A professionally challenging aspect arises when observed progress in a controlled setting does not translate to real-world application, raising questions about the robustness of the intervention and the technician's data interpretation. Careful judgment is required to differentiate between superficial learning and true skill acquisition that is adaptable and enduring. The correct approach represents best professional practice because it directly addresses the core principles of generalization and maintenance by actively seeking evidence of the skill's transferability and persistence. This aligns with ethical standards that mandate effective and evidence-based practice, ensuring that interventions lead to meaningful and lasting behavioral changes for the client. By systematically evaluating the skill across different contexts and over time, the technician is not only demonstrating competence in data collection, but also in the critical analysis of treatment outcomes, which is essential for client progress and informed decision-making regarding intervention adjustments or discontinuation. This proactive approach ensures that the client's progress is not an artifact of the training environment, but a genuine improvement in their functional behavior. An incorrect approach that focuses solely on the initial acquisition of the skill in the training setting fails to meet the ethical obligation to ensure functional and lasting behavioral change. It overlooks the fundamental goals of generalization and maintenance, potentially leading to a false sense of success and continued reliance on an intervention that is not producing meaningful real-world impact. This can be considered a failure to adhere to best practices in behavior analysis, as outlined by professional ethical codes, which emphasize the importance of socially significant behavior change that is generalized and maintained. Another incorrect approach that relies on anecdotal reports without systematic data collection is professionally unacceptable. While client or caregiver reports can be valuable, they are subjective and can be influenced by various factors. Ethical practice demands objective, measurable data to support claims of generalization and maintenance. Without this, decisions about treatment efficacy are not evidence-based, potentially harming the client by prolonging ineffective interventions or failing to identify the need for further support. This also violates the principle of data-driven decision-making, a cornerstone of behavioral services. A further incorrect approach that assumes generalization and maintenance will occur spontaneously without specific programming or evaluation is also a failure of professional responsibility. Effective behavioral interventions often require deliberate strategies to promote generalization and maintenance. Assuming these outcomes will happen without active planning and monitoring is a passive stance that can lead to the dissipation of learned skills and a lack of long-term benefit for the client. This demonstrates a lack of understanding of the principles of behavior change and a failure to implement comprehensive treatment plans. The professional decision-making process for similar situations should involve a systematic evaluation of the client's progress against clearly defined goals for generalization and maintenance. This includes 1. Establishing specific, measurable, achievable, relevant, and time-bound, SMART goals for generalization and maintenance. 2. Implementing planned strategies to promote generalization e.g. training in multiple settings with different people, using varied stimuli and maintenance, e.g. fading prompts, intermittent reinforcement. 3. Collecting ongoing, objective data across different settings and over time to monitor progress towards these goals. And 4. Using this data to make informed decisions about the effectiveness of the intervention, the need for adjustments, or the eventual discontinuation of services. Question 18. Which approach would be most effective in promoting the generalization of a newly acquired social interaction skill from a controlled therapy setting to the client's home and community environments? Option A. Focusing exclusively on intensive practice of the skill within the therapy room until perfect performance is achieved. Option B. Assuming that the skill will naturally transfer to other environments once the client demonstrates mastery in the therapy session. Option C. Introducing the skill in the home and community environments without prior explicit training on how to adapt it to those specific contexts. Option D. Systematically teaching the skill using varied stimuli and reinforcing its use across different people and settings that are relevant to the client's daily life. The correct answer is D. Systematically teaching the skill using varied stimuli and reinforcing its use across different people and settings that are relevant to the client's daily life. Explanation. Scenario analysis. This scenario presents a common challenge in behavioral technician practice, ensuring that newly acquired skills are not confined to the therapy setting, but are utilized effectively in the client's natural environment. The professional challenge lies in bridging the gap between trained behavior and generalized application, which is crucial for meaningful and lasting client progress. Failure to promote generalization can lead to a perception of limited treatment efficacy and can hinder the client's independence and quality of life. Careful judgment is required to select strategies that are not only effective, but also ethically sound and aligned with best practices in applied behavior analysis. Correct approach analysis. The correct approach involves systematically planning and implementing strategies that facilitate the transfer of learned behaviors across different settings, people, and stimuli. This aligns directly with the core principles of applied behavior analysis and the ethical guidelines for behavioral technicians. Best professional practice dictates that generalization is not an afterthought but an integral part of the intervention plan. This includes teaching skills in a way that is inherently adaptable, such as using varied stimuli and reinforcing behavior across multiple relevant contexts. Regulatory frameworks and ethical codes emphasize the importance of client progress and functional independence, which are directly supported by effective generalization strategies. Incorrect approaches analysis. One incorrect approach would be to solely focus on mastering the skill within the controlled therapy environment, without any deliberate attempts to prompt or reinforce its use in naturalistic settings. This fails to meet the ethical obligation to promote functional independence and may violate guidelines that require interventions to be client-centered and focused on real-world application. Another incorrect approach would be to assume that generalization will occur spontaneously once the skill is mastered in therapy. This passive approach neglects the proactive strategies required for successful transfer and can lead to wasted therapeutic effort and client frustration, contravening the principle of providing effective and efficient services. A third incorrect approach might involve introducing new, complex stimuli or environments too abruptly during generalization attempts, overwhelming the client and potentially leading to skill regression. This could be considered a failure to implement interventions in a manner that is sensitive to the client's current capabilities and learning history, potentially causing harm or distress. Professional reasoning. Professionals should approach generalization by first identifying the target environments, people, and stimuli where the skill is intended to be used. The intervention plan should then incorporate specific strategies for teaching and reinforcing the behavior in these varied contexts. This might include training significant others, using naturalistic teaching methods, and fading prompts systematically. Professionals must continuously assess the client's performance across different settings and adjust strategies as needed. This iterative process ensures that interventions remain effective and ethically aligned, with promoting the client's overall well-being and independence. Question 19. The review process indicates that a client's parent has expressed a strong preference for using a specific behavioral intervention that was widely practiced in the early days of behavior analysis, citing its historical importance. The behavioral technician is aware that this intervention has largely been superseded by more empirically supported and individualized approaches for this client's specific needs. What is the most appropriate course of action for the behavioral technician? Option A. Politely inform the parent that the suggested intervention is outdated and not currently used in practice. Option B. Discuss the parent's suggestion with the supervising BCBA to evaluate its current efficacy and appropriateness for the client's treatment plan. Option C. Proceed with the current treatment plan without addressing the parent's suggestion to avoid conflict. Option D. Implement the intervention as requested by the parent due to its historical significance and the parent's strong preference. The correct answer is B. Discuss the parent's suggestion with the supervising BCBA to evaluate its current efficacy and appropriateness for the client's treatment plan. Explanation. This scenario presents a professional challenge because it requires a behavioral technician to navigate a situation where a client's family member is advocating for a treatment approach that, while historically significant, may not align with current evidence-based practices or the client's individualized treatment plan. The technician must balance respect for the family's input with their ethical obligation to implement interventions supported by current research and tailored to the client's needs. The core of the challenge lies in the tension between historical understanding and contemporary application of behavioral principles. The correct approach represents best professional practice because it prioritizes the client's well-being and adherence to current ethical and professional standards. By consulting with the supervising BCBA, the technician ensures that any intervention, regardless of its historical roots, is evaluated for its efficacy, ethical implications, and alignment with the client's current treatment goals. This collaborative approach upholds the principle of providing effective and ethical services, as mandated by professional guidelines that emphasize data-driven decision-making and client-centered care. An incorrect approach that relies solely on the historical significance of a technique, without considering its current efficacy or appropriateness for the individual client, fails to adhere to the principle of providing evidence-based practice. This could lead to the implementation of ineffective or even harmful interventions, violating the ethical obligation to act in the client's best interest. Another incorrect approach, which is to dismiss the family member's suggestion outright without professional consultation, demonstrates a lack of respect for the client's support system and a failure to engage in collaborative problem-solving, which is crucial for successful treatment outcomes. This can damage the therapeutic relationship and create barriers to progress. Professionals should approach such situations by first actively listening to and acknowledging the concerns and suggestions of the client's support system. They should then consult with their supervisor, BCBA, to discuss the historical context of the suggested intervention, its current scientific standing, and its relevance to the client's specific needs and goals. This consultation should inform a data-driven decision about whether to incorporate, modify, or decline the suggestion, always with the client's best interest as the primary consideration. Question 20. The analysis reveals that a behavioral technician has successfully taught a client to request a preferred item in a one-on-one session with the technician in a clinic setting. To ensure this skill is functional and maintained in the client's daily life, what is the most appropriate next step according to the principles of generalization and the ethical guidelines for behavioral technicians? Option A. Systematically introduce opportunities for the client to request the item from different people, e.g., family members, peers, in various naturalistic settings, e.g., home, playground, while providing prompts and reinforcement as needed. Option B. Ask the client's parents to practice the skill with the client at home without specific guidance from the technician, trusting their parental judgment. Option C. Assume the client will naturally begin requesting the item in other environments as they become more comfortable, and focus on teaching new skills in the clinic. Option D. Only practice the skill in the clinic with the same technician, ensuring perfect performance before considering other environments. The correct answer is A. Systematically introduce opportunities for the client to request the item from different people, e.g., family members, peers, in various naturalistic settings, e.g., home, playground, while providing prompts and reinforcement as needed. Explanation. The analysis reveals a common challenge in behavioral technician practice, ensuring the generalization of learned skills across different environments and individuals. This scenario is professionally challenging because the client's progress in a controlled setting does not automatically translate to other contexts. The technician must actively plan and implement strategies to promote this generalization, which requires careful consideration of the client's specific needs and the characteristics of the new settings and people. Failure to do so can lead to a plateau in progress or a regression of skills, impacting the client's overall well-being and the effectiveness of the intervention. The correct approach represents best professional practice because it directly addresses the principle of generalization, a cornerstone of applied behavior analysis. By systematically introducing the client to multiple settings and individuals, the technician is actively working to ensure that the target behaviors are not stimulus-bound to the original training environment. This aligns with ethical guidelines that mandate effective and evidence-based practices, ensuring that interventions are designed to produce meaningful and lasting change. The Behavior Technician Specialist Certification Framework emphasizes the importance of generalization as a critical component of successful behavioral programming, ensuring that clients can utilize their learned skills in their natural environments. An incorrect approach that involves solely relying on the client to generalize skills without structured intervention is ethically problematic. This fails to meet the standard of care and can be seen as a lack of diligence in implementing the treatment plan. It neglects the technician's responsibility to actively facilitate generalization and can lead to a violation of the client's right to receive effective services. Another incorrect approach, such as only training in one setting with one person, limits the client's opportunities to demonstrate and maintain skills in diverse situations, potentially hindering their independence and integration into various social contexts. This approach is not aligned with best practices for promoting robust and adaptable skill acquisition. Professionals should approach this situation by first reviewing the client's treatment plan to identify specific generalization goals. They should then collaborate with the supervising BCBA to develop a systematic plan for introducing new settings and people, ensuring that the training in these new contexts is conducted in a way that reinforces the target behaviors. This involves careful observation, data collection, and modification of strategies as needed. A professional decision-making process would involve assessing the client's current skill repertoire, identifying potential barriers to generalization, and proactively designing strategies to overcome these barriers, always prioritizing the client's progress and well-being.